Ebola is treatable.
Since the first cases were reported 6 months ago, the tally of Ebola cases in West Africa has reached an estimated 5,800 infections. Nearly half of the infected cases have lost their lives. And new estimates from the World Health Organization warn the number of Ebola cases could hit 20,000 in 6 weeks unless efforts to curb the outbreak are ramped up.
One of the key messages that we want to get across is that we are now in the third explosive phase of growth of the epidemic. This is exponential increase with hundreds going into thousands of cases per week. And if we don't stop the epidemic very soon, this is going to turn from a disaster into a catastrophe.
In recent weeks, health officials across the world have stepped up efforts to provide aid, but the virus is still spreading. There aren't enough hospital beds, health workers, or even soap and water in the hardest hit West African countries, Guinea, Sierra Leone and Liberia.
It's a large epidemic, however, so we're nowhere close to controlling this, and clearly this whole epidemic is going to run on for a few more weeks or months. So there are three possible views of the future from here, if you like. If we don't do anything immediately, then the exponential growth that has been forecast will continue, so far as we can see, and we'll have not a few thousand cases, but probably tens of thousands of cases. If control is completely successful in the way that we know it can be, then Ebola will disappear from the human population of West Africa and probably return to its animal reservoir.
But all hope is not lost. Global powers including China, the US, Britain and France, alongside organizations like the African Union, the World Bank and UNICEF, have so far stepped up efforts and aid to help tackle the outbreak. Wazir, Khamsin, CCTV.